Hi, everyone, and welcome. We're your hosts. I am Justin.
And I'm Challee.
This podcast is a space where we explore practical ways to nurture your mind, body, and spirit to create a happier and healthier life.
The content of this podcast is intended for informational and educational purposes only. It is not a substitute for professional mental health advice, diagnosis, or treatment. Listening to this podcast does not establish a therapist-client relationship. If you are experiencing emotional distress or mental health concerns, please seek support from a licensed therapist or a qualified healthcare provider.
Hi, everyone, and welcome back. Thank you for tuning in today. We are going to be talking about imposter syndrome. I know there's some other words for this too, but I've most commonly heard it as imposter syndrome, and I think it is more common than maybe what we think. I know it was something really new to me over the past couple years, but I definitely feel like I've experienced it, and I know other people that have probably experienced this as well.
Disclaimer, imposter syndrome is not an actual diagnosis. It's not an actual syndrome. It is just nicknamed imposter syndrome. So I just want to clarify that.
Talking about this, we can experience the different pieces, and it does not have to be a label. Truthfully, this is something that we normally go through in a period of time. So it's not something that lasts forever. Hopefully we're able to work out of that cycle and work through it, but it can be some different feelings that show up, maybe some self-doubt, and we'll get farther into that. What's your thought with imposter syndrome? Where do you think it most shows up?
For me personally?
Yeah, let's go on that side.
Okay, well, when I'm in interdisciplinary meetings and I'm following along and someone says, well, I think we need to consult the mental health expert on this. And I'm sitting there yeah, we do. And then they look at me and I'm like, crap, that's me. That's me. Oh my gosh. It's a lot of self-doubt. I'm just trying to speak from personal experience. It feels like you're faking it. It feels like you're winging it. I know a lot of times I feel like I'm just completely faking it, and it's almost like this feeling of it's going to catch up to me. Eventually everyone is going to realize that I have just been faking it and winging it for the last however many years. Mm-hmm. And I'm still experiencing it.
Yeah.
So
would you say it comes in waves?
Yes.
Okay.
For sure, it does. No matter how much schooling you do or how much experience you have, you're not going to know everything and have all the answers. But when you don't, and it feels like you should, it's kind of like you start to doubt everything. Mm-hmm. So that's how I experience imposter syndrome.
I appreciate you sharing that. I think it becomes really overwhelming, too. So I know for me, when I've experienced this, currently experiencing it, I know that it, for me, has kind of come in waves. There will be times that I'm like, okay, I got this. And then other times where it's complete opposite side. I'm like, well, what do I think that I'm doing? This is the big one. Who do I think that I am?
Yes. Yep.
And I'll second guess myself, kind of going into that doubt piece. But it's
Yes.
deep. I feel like I'm an imposter or a phony.
Yes.
Is the word that comes to mind for me.
Yes. And you're going to get caught. They're going to figure it out eventually that you actually have no idea what you're doing. But you do. That's the frustrating part.
I know for me, with a lot of the changes that are going on, it can also come into the feeling of not deserving. Not deserving, whether it be praise or opportunity. And for myself, that's prevented me in the past from taking opportunity, and for me now has shown up as me really having to be a little bit tough with myself and make sure that I am being realistic and reminding myself of the things that I have done and that there's a reason for it, rather than letting those self-defeating thoughts come in. So maybe not being tough with myself, giving myself some grace, but being firm with myself. Okay, this is what you've done it. Making sure that I'm not doubting myself or minimizing myself, because I have a tendency to do that.
Same.
Yeah. What do you think might be some causes of this?
Gosh. I mean, myself, I struggle with anxiety, so I feel like that doesn't help because I spiral down the rabbit hole of imposter syndrome and the anxiety does not help. It fuels it, if anything. And I can't speak to this personally, but I would say not having the support that you need. I'm trying to think of like the opposite, because that is what helps me. But if I didn't have that, that would definitely make it so much worse. Does that make sense?
Yeah.
Okay.
I think when looking at it, there's not one answer to what causes it. There's not like only one circumstance. It's so many different things that can weigh on this and weigh on us mentally to beat ourselves up. I know, so again, like speaking the personal side of it, I know I had some really terrible self-talk that then give me a little bit of doubt. I'm spiraling with it. I'm going down the rabbit hole, finding every reason, all those evidence that my brain is saying that, well, I'm not making it. I'm not doing what I am saying that I'm going to do. I think a protective factor, something that can help it, is that support, building our confidence, being able to see black and white progress can be so beneficial as well. So if it's potentially a grade or a performance review, and actually acknowledging it rather than saying, they're just saying it to be nice, or I didn't earn that, like they're being nice, they're giving it to me. No, being realistic that if someone's providing us black and white proof, believe it.
On the opposite end, though, having the lack of black and white proof is really hard. And I feel like as a therapist, there isn't always that black and white, and that definitely fuels it as well. If a client leaves feeling just as crummy as they did when they came in, it kind of leaves you with this, if I was better, I could have fixed that in the 45 minutes that they were here. I must not be doing what I need to be doing. Well, maybe because I have no idea what I'm doing, maybe because I'm just winging it, like you spiral. Yeah. And so the support is important to then bounce it off of someone. Like if I called my supervisor and I was like, this is what happened, to be told, that's okay. Look at my supervisor, like she is just the most wonderful clinician in the world. And so if she says like, that's okay, that happens to me, that's what happens, I'm just like, wait, that happens to you, but you're like a real therapist. So okay, maybe I'm not a fake therapist if it happens to both of us. So just having that person to like bounce things off of is so important, and having the comfortability to be able to do that, because our boss, she knows that I am just a ball of anxiety, and I will text her and just say like, hey girl, I'm spiraling. Can you just tell me if this is okay? And yeah.
So 2 things that I want to kind of take out of that. First one being, goodness, if you don't have that support, that could just fuel that. Like we said, but then even going that step farther, if maybe we work in an environment that feels off of us being like a people pleaser or having no boundaries, we're always going to be in this spiral or spot of not being good enough, and then we're going to get burned out. And then we might just get burned out entirely, where it's impacting us. And I've seen clinicians leave the field entirely. Second thing, have you ever had this experience where a client requested to go to a different therapist?
Yes.
Yeah? How'd you take that?
I took it fine.
Yeah?
I don't know. It was when I was newer in the field. And so she had a specific concern that she wanted to focus on. And I had met with her a few times, but then she had said that she wants to find someone who specializes in that specific thing. And so I did have that negative self-talk of like, wow, you could not help her. But then I had to remember, that's okay. I don't specialize in that. And then I was like, I'm so proud of her. I may not have been able to help her with that problem, but I definitely helped her to be able to say, I need something different. And I love that. If it were to happen, no, I would not be upset, because where I am now in my career is I know my strengths and I know the things that are not my strengths. I know the things that I don't specialize in that I could help, but I wouldn't be the best person to help. If you're going to leave me to go find someone who specializes in a specific thing that you're struggling on, that's amazing. Give me their info in case, like, we need it. But it's never, like, it's never really bothered me that much.
Which is great.
I bet you were
That's so
expecting
healthy.
a different answer.
I guess I was thinking of my experience where opposite of that. And it was, again, where I'm at now would be different, and I think I'd be able to have, I know I would be able to have that piece of, okay, it's just not the best fit. And now I'm able to make the conscious piece of, it's not helpful if they're not getting anything out of it. It's not helpful if I just try to make it fit. That's not going to work. But it was earlier in my career, I had someone who I enjoyed working with, and they had asked, I think it was the supervisor or someone else that they did group with, to switch counselors. I was devastated at first. And because it was that imposter syndrome, I was newer in the field. I wanted to try and help everything and everybody, and I didn't realize that help isn't helpful if it's not helpful. So I was trying to provide solutions on something I didn't have experience about. We just didn't connect on something. And that was okay. But I initially spiraled. And I was like, I'm terrible at this. I'm not doing it. And I even went to like the all or nothing of like, I don't work well with anybody. If she's requesting to leave, then I'm not good at this. And it spiraled. I talked to my supervisor about it. She validated the fact that not everybody works well with everybody. And that's okay.
And sometimes there's no reason. Sometimes just the vibe isn't there.
Yeah.
And that's okay. I have had to suggest to clients that they switch to a different clinician because I didn't feel like they were getting as much as they should be. I don't know how else to explain it. Sometimes the vibe is just off. And it sounds kind of silly, but like you really need to vibe with your therapist at least a little bit.
Yeah.
So there is a plethora of reasons why you might switch. Also, in my personal life, I have switched therapists like a couple times before I found the one that I've been working with. So sometimes it's just the vibe.
Side note on that happens. And can be really tough if someone is coming in for their first time and it's like they're just like one shot of being able to do it and they don't mesh well with the person. That can be really tough. But it's not hopeless. It doesn't mean that therapy is not going to work. It's just not that right person. And so I think that to be talked about more often. I mean, it's realistic. You don't become best friends with everybody that you first meet. There's a reason. Like, you have interests, you have common pieces. The vibe is just different. So it works the same way. I know for me it was really tough in that, like, first, I don't even want to say day, because I knew I had to go talk to someone about it sooner rather than later. And it was just that self-doubt and that self-defeating. So it was really something more that was not resolved in me than it was the other person.
Can you share if you ever got a reason?
Yeah, it was because I wasn't a mother.
Yeah, see?
Right? It was something that was so far out of my control.
Yep.
Because she was dealing with very specific things going on with her children, and I wasn't a mom. Like, we couldn't relate.
The vibe wasn't there.
Yeah, had nothing to do with me. There was nothing that I was physically going to do to be a better person for her.
Yeah, you can't be a
couldn't
mom. Sorry.
There are some things that are just outside of the control. That was funny how that worked, because I went through all of it, I like spiraled, and then I kind of convinced myself that, it's not a one-size-fits-all for therapy, and that's okay. And then it was like a week later that I had gotten the information. It was really simple. It was more simple than what you probably made it out to be. Not from her, I got it from another clinician, but she had shared it she was just dealing with some really specific things, and she liked me as a person. And, it was nothing wrong with me. But it showed how there was something unhealed or unresolved within me that I took it personally.
Ooh, okay.
Yeah. And I think that, getting back to talking about imposter syndrome, sometimes that can really be a result of something unhealed in ourselves. And it can be, again, taking the blame out of it. It doesn't have to be that we were treated poorly as a child. It could just be that we saw people in our life being really productive and set an unrealistic standard for what we then set for ourselves, or we just set unrealistic standards for ourselves.
Do you think it could have anything to do with the people pleasing that we are all guilty of? Because it's like, you caught yourself. Because, we are such people pleasers and we just want to please everyone. And so if we can't, or we feel like we can't, we're not good enough.
Right? Not good enough. That's something that I think I had picked up at a young age and had just traveled with me. And whether there be a specific reason to it, I'm sure so many people have that feeling of like not being enough or being too much. And that really feeds into experiencing imposter syndrome. So you hit the nail on the head with that of the not being enough. That can be one of those seeds that start then when we become an adult and we're starting to become, whether it be more productive or more in view of other people, there's more judgment and it just grows. When trying to identify what those roots are, it can be really tough and it might be a pretty deep dive. I know for me it was. So it's not something that you identify it and then it's fixed. Once you identify it, that's a huge step that like, okay, hey, this might be what I'm experiencing. I can really relate to that self-doubt. I can really relate to those different pieces of it. And it's going to be really unique and personal to us of how we work to resolve that. And it can take some time. I know for me it has. It's something that still shows up. And I've goodness been in school for a long time and be able to have that level of insight, and sometimes I still don't know what's triggering it. It can many times be a result of some big change and feeling uncomfortable. It might be like getting that big girl job or big boy job that we have dreamed of, and then we finally get there and then it's like, oh my goodness, I'm not able to do this. Can you think of any other places that it might show up?
Oh God. I wanted for so long, my goal was to have LMSW after my name. That was my goal for so long that when it finally happened, it felt fake. Like it didn't feel real because I guess I never thought I would actually do it.
Okay.
I really struggled through my bachelor's degree and I did not think I was going to even go back to get my master's. I definitely didn't think I was going to thrive during my master's program. And then I never thought I'd get, like, I just didn't think it was going to happen. And then it all happened. And I don't know, it didn't feel real. And so when somebody was like, oh yeah, you're a licensed social worker. And I'm like, that's right. I do have those letters. That's true. Yeah. But even working in the school as a school social worker, I was the only school social worker in the district for the whole district for elementary and high school. And so it was a lot of like, let's ask the social worker. And I'm sitting there like,
let's go find one.
I'm brand new. Actually, one of my favorite things is if I want to like look up what to do for certain mental health issues. Like if I have a client that has something and I want to get some different ideas. And I love it when I Google like approaches to, I don't know, like generalized anxiety disorder or whatever in kids. And it says like consult a therapist. And I'm like, okay, all right, well, so that does not help.
Yeah.
Because it's basically saying, hello, you should know this. You're the person that Dr. Google is telling people to go to. And I'm like, okay.
It can be really tough because when you're thinking about it, that you're trying to help different people, you're trying to be that go-to, sometimes life may be chaotic in itself. So I know for me, times that life is more chaotic, imposter syndrome shows up a little bit more because I'm like, oh my goodness, what do I think I'm doing? I can't even figure adulting out, and then here I am trying to do this. What's going on? So for me, that's kind of where it's shown up as like some different points of chaos.
I struggle with when my son struggles with things, and it feels like I can't even help my own son with his big emotions and his behavior. How am I supposed to help other kids?
I think even switching a little bit outside of the professional piece, even like as being a mom, I think moms can experience imposter syndrome because like, holy crap, I'm expected to like keep this alive.
You just handed me a small human? Like, I'm not qualified for this. What is this? Yes.
So that might be one that shows up a little bit more naturally, and that can be really tough. So thinking about how it can show up in different places can show up in different ways as well when we're talking about, like, it might be the mental piece of, like, a spiraling and going down the rabbit hole of terrible things. Sometimes it can even be just holding ourselves to those unrealistic expectations and trying to be perfect. Something that goes along with this many times is, like, perfectionism and holding ourselves to that unrealistic expectation, there's no way we can accomplish it. And so we're continuously setting ourselves up to be disappointed with ourselves. What are some ways to maybe challenge this imposter syndrome and to maybe work through it?
Well, your life will change when you accept the fact that you will never be perfect and you embrace that. So I have really worked on doing that. And if I do have those moments in a meeting or in a session where I'm just like, I have no idea what I'm doing. No idea. Instead of spiraling, I just try to like reframe. So I will say, I'm not sure. Let me give that some thought and really think about it and get back to you next time, because I really want to put more thought into it. I don't want to just answer on a whim.
That's huge.
Yeah.
So giving yourself that grace and that time. There is no one in this world that has every answer to every question at the specific time. Mm-hmm. Being able to be realistic about that, like, hey, I might have to look a little bit more into this.
I mean, sometimes even doctors have to do that, you know?
Self-care can be a really big piece that helps with imposter syndrome. Just being able to be kinder to ourselves, but also spend time doing the things that pour back into us and make us feel well is going to give less room for our brain to spiral. This might also show up as, back to that feelings of anxiety, not taking the opportunity to do something because we feel as though we can't do it. That might be in more of the intense ones where we just completely don't do it because we don't think that we can do it. And then we stay stuck.
Can I call you out?
Yeah.
Are you feeling any type of imposter syndrome knowing that you're going to be a clinician like within the next couple months?
Oh, yeah.
And it's pretty much set that that is the path that you are taking.
Oh, 100%.
Working with a population, kids that you said you were never going to work with. And now all of a sudden you are preparing to kind of take over a big chunk of my caseload. So I wonder if that has anything to do with why imposter syndrome was brought up.
Definitely. I definitely think it's something that I have experienced in the past, but also is coming up now, probably the most intense that I've ever experienced it, because there's so much shift going on. I'm finally accomplishing kind of the end goal, at least like kind of how you said with the license, having those letters. It's okay, like I've just been in school for so long, and like my school journey has taken me a little bit longer. You know, I took some detours, so
same.
I think that it's always just been like a thought that it's like, okay, that's what I'm working towards, but like being within these last few months and like, oh my goodness, I do feel more prepared because of having support. So thank you. Thank you to the team. Like that has been huge. And so I think that's what's maybe minimized the bigger pieces. But like there has been so many times that I just want to like cut around and be like, nope, it's not for me. I'm going to screw this all up. I'm not going to do it. Who do I think that I am? Like working with kids. I'm going to mess them all up. Like those are all the things. And I think that it has really been through the support piece and being able to share the experience and share struggles along the way and get some of that validation that I've been able to stick with it. Like I wanted to not, because that self-doubt and that fear that comes up. And yeah, I think this is probably the most intense that I've felt it. And I think that it has also ramped up some of my other maybe like symptoms of anxiety, because then, well, if my anxiety symptoms are already heightened because of this, then it spreads into something else. And then, well, what do I think I'm doing with work? But then what do I think I'm doing in life? Like, who do I think that I am? And so it's kind of been a piece of like an identity shift too, from like going from being a student to then being a clinician.
Yes.
That's going to be really weird. I've just, goodness, for so long been in the role of a student. So transitioning from the role of a student to then working more independently, that's been a big thing that I think has weighed on my mind of, I'm ready. So
I don't know if I'm ready, and it's been like how long since I graduated, but I'm winging it.
Appreciate you sharing that, because that it can feel so alone. I guess that's something that I thought a little bit more about when we were talking about doing this topic, was if I'm feeling like there has to be other people that are feeling this, but for so long I felt like it was just me. Like everybody else, they know what they're doing. So they're going to look at me and think that I'm, less than or not enough because I'm having these doubts. Have those conversations and communicate about it has let me know that other people do experience this too. We're all just trying our best.
I experienced it with you when you shadowed me at first. And I was like, okay, he's shadowing me, but then if he's going to shadow all the other clinicians, what if I actually just suck and I don't know it? And then the interns are going to see how awful I am because they're seeing the other real clinicians do it. And so I was very nervous at first to have interns with me because, like, I can't compete with other clinicians on our team who are freaking amazing. I look up to all of the people on our team. You know what I mean? Like, I feel like they're up here and I'm down here and I'm just kind of like looking up at them like, you guys are amazing. So to be on that same field of like, okay, you're observing my sessions and her sessions, like, I was really nervous. Because I was like, what if I am just awful? And they're going to be like, wow, she's sitting here playing Candyland and the other clinicians are doing real, you know, in-depth work. And so, yeah, you were not the only one with imposter syndrome.
Thank you for that vulnerability, because I would have had no clue. I appreciate that. Also, you're right up there with the clinicians, but it's so crazy to think about where we put ourselves. Where I view you as being right up there. And it sounds like there's times that you don't. So difference in perception.
Yeah.
And how critical we are of ourselves. I would have never known that.
Yep, there it is.
Vulnerable we
It
got.
has nothing to do with licensing. Like, a couple of them are, you know, have more advanced licenses than I do right now. And it has nothing to do with that. It's just I hear them speak so well. And I'm like, I don't. I'm very, like, real. And I'm not very clinical. And so sometimes that makes me doubt myself. Is I'm not coming out with these terms that they know off the top of their head. And so, yeah, it makes me feel inferior. But I
That's
also...
a good word.
But I also have to remember that I work mostly with kids and teens, so I don't want to use clinic, you know what I mean? Like, the way I approach things is different, and that's okay. But at first, I was like, I'm sitting here playing in a sandbox and doing tracking. Remember I was showing you, like, tracking with play therapy. And I just remember being like, I must sound insane. Just being like, yes, you're using the truck. Oh, now you're using that. Oh, now you're doing that. And I said, like, I never realized how silly it must sound until I had somebody watching me.
To be fair, that feels silly in general. Just feels silly to do that. Like, I remember when I started doing that, I was like, this is exactly what Challee talked about. Like, this feels so strange.
Yes, yep.
And I think that I can relate on that piece of not feeling adequate in conversations. I even felt that in school, like in discussion boards. I'm like, oh my god, that person's so smart. Like, look what they came out with. And I'm like, I don't think I'm doing that. But I'm still getting a good grade. And I'm still getting something from it. So I think that I've had to try and give myself some grace in that and be kinder to myself, because I was just mean to myself in the things that I would say, and then that would fuel doubt, and then I would just spiral even harder. Imposter syndrome. It shows up, and it shows up in so many different ways. I know for me, until I had a word for it, I was just having such a hard time talking about it. I didn't know how to talk about it with people. And then I finally got the word for it, and I'm like, oh, that makes sense. And then I was able to start having that conversation with people on the team, with people in previous employment, and figure out that it's a little bit more relatable than definitely what I gave credit to. I thought I was the only one that had ever experienced this.
Yeah. I had it. One of my clients was telling me, like, stuff about what was going on, and then they were like, yeah, and they said I should really talk to a therapist about it. And, you know, you're sitting there and you're like, yeah, no, you definitely should. Oh, wait, no, that's why you're... No, it happens. Where people will be like, can I have a therapist's advice? And I'm like, yeah, do you want their phone number? Or
Let's go find one.
I mean, I'm a therapist, but we can find like a more adult therapist. More grown up. Like, I'm a grown up, but I'm not like a deluxe grown up. Like, just like momming. Listen, I'm a mom, but like I'm not a deluxe mom. Like, I'm winging it.
So I think it would be Wonderful to hear if anybody else has experienced this, any ways that we've been able to work through it.
Yes, please share if you have experienced imposter syndrome and what you do to counter it, because that would be so helpful and we need all the support we can get.
So thank you guys for joining. I hope this was helpful and maybe can give you a word for some of the things that we might experience. I know for me it was really helpful to be able to just identify kind of what's going on. Got me out of some of that self-doubt.
Yep.
So thank you guys for tuning in this week.
Bye, guys.
Bye. Thank you.